fibroids, these are muscular non-cancerous tumors, okay, that range in size from a small seed to as large as a grapefruit, or even larger as a watermelon. Now, another thing is they can grow in or on the uterus. That thing is uterine fibroids. They can grow very slowly. Okay, they can also grow rapidly. Okay, they can increase very rapidly. And another thing is uterine fibroids can actually remain the same size for years. So you see some person, yes, they state that yes, they have fibroids. Actually, that fibroids, that size that you made it, can actually remain for years. Okay, and also uterine fibroids can actually shrink by themselves. That's how much they can shrink by themselves. For uterine fibroids, some of the symptoms mostly experienced by women, though some women do not experience any symptoms at all. I take it that most of them it could be of that small seed size that I'm talking about. But for the others who experience symptoms, most of the times the symptoms they experience mostly frequent urination, we have backache, they mostly experience painful menstruation. Yes, painful menstruation, painful sexual intercourse. I mean, when having sexual intercourse, they experience painful sexual intercourse. They also experience fullness. I mean, when you feel full around your stomach region. So some of these are symptoms, and sometimes excessive menstruation, excessive menstrual bleeding, heavy painful menstrual bleeding. I think that's the first symptom. So these are some of the symptoms experienced by most. So if you are in that position, you feel such, it's best that you speak to your pharmacist about it, so they can recommend or refer you to do some tests, and they see the gynecologist or specialist. Now these are the symptoms. Now, but no one has ever been able to know the real cause of it. The cause of fibroids has not actually been known. But sometimes estrogen and progesterone, we believe they are the major hormones which actually get triggered. These are major cause of fibroids. Why? Because now, during pregnancy, the body, your uterus actually needs your progesterone and needs your estrogen, which is why fibroid gets larger during pregnancy and they shrink during menopause, because they usually decrease in the level of these hormones. Okay, that's why we believe it's been triggered by these hormones. But other factors which could cause fibroid, we have family history. If in the family there is an history of fibroid, if you're obese, alcohol usage, taking alcohol, and also for those who have had early onset of menstruation. I'm talking about those who started seeing their menses as early as 9 years, 10 years, 8 years, 10 years, yes, 9, 10 years, but not all. But these are some of these other factors, and of course they have their very minimal percentage. Now these are the other factors which could predispose one to having fibroid. Some medications that your doctor might prescribe for you. You might have seen some birth control pills. Now what these drugs do, what these medicines do, now they manipulate your hormones. They help to control excessive bleeding, but some of them do not necessarily control the size of the fibroid, which is supposed to be our goals. Okay, introducing to you high strength vitamin D. Okay, when you find out that the size of the fibroid is about that small seed size, okay, high strength vitamin D can actually shrink the size of the fibroid. How do they do that? They inhibit the production of the estrogen and the progesterone. They have the ability to inhibit it. They have anti-estrogenic and anti-progesterone effects, which means they can actually inhibit the production of these hormones, thereby shrinking the size of the fibroid. But you might need to take it for some time, and some months, before you get that total benefits. Okay, so high strength vitamin D has been shown to shrink the size of fibroid by about 60%. Okay, that's what our researchers have shown. So